Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode on the Health Trip Podcast. August is Hair Loss Awareness Month, and I am committed to educating you about hair loss in women in midlife, a topic that many women silently struggle with, yet it's really discussed openly. As women enter their 40s and 50s, the chances of experiencing hair thinning or significant hair loss increase due to various factors, including hormonal changes, genetics, stress, and even nutritional deficiencies. Hair is often closely tied to identity and self-confidence, so these changes can feel particularly unsettling. I've been on my hair loss journey for the past 25 years, and if you've been following me on social media, you can see that I share a lot of the devastating effects of hair loss. In today's episode, we'll delve into the root causes of hair loss during midlife, from hormonal fluctuations of menopause, which can lead to conditions like androgenetic alopecia, which is what I have, to the impact of stress and lifestyle choices. We'll explore why these factors play such a significant role. Additionally, we're going to look at some common myths and misconceptions about hair loss and provide science-backed insights into what's really happening on a biological level. But it's not all gloom and doom. There's hope and help available. We're going to discuss science-backed treatments that have shown promise in not only halting hair loss, but also in promoting regrowth. From topical treatments like minoxidil to newer therapies like red light therapy and platelet-rich plasma, to also more natural herbal remedies, we're going to break down all the options and their effectiveness and what might be right for you. Our goal is to equip you with the knowledge and resources you need to take control of your hair health and embrace this new phase of life with confidence. Dr. Allen is back on the Health Trip Podcast to share his expertise and the future of hair loss and regrowth in midlife women. He's a full-time board-certified hair restoration physician who's treated over 33,000 patients. He also started his medical hair loss practice called Bauman Medical in 1997. He's also known for pioneering numerous technologies in the field of hair restoration, including the minimally invasive FUE follicular unit extraction, red light therapy, PRP platelet-rich plasma, PDO grow, which we're going to talk about today, eyelash transplants, and others. He is a frequently invited faculty member and guest expert at numerous international scientific meetings, and has been featured in hundreds of news stories in the media, including NBC Today, the CBS Early Show, ABC Good Morning America, CNN, The Doctors, Vogue, Harper's Bazaar. It goes on and on. He was also voted the #1 hair restoration surgeon in North America by Aesthetic Everything for the 6th consecutive year. We are in very good hands today, ladies. Just a short medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any of my guests on my podcast. So sit back, open your mind, and let's dive into the world of hair loss in midlife women. Hi, Dr. Bauman. Welcome back to the Health Trip Podcast.
Hey, Jill. Great to be back with you.
Yeah, I'm so glad to see you because it is Hair Loss Awareness Month. And what better way to round out this last week than to talk to someone who is a world expert?
Oh, well, thank you.
Yeah. And so we're here talking to a community of menopausal midlife women who are, we know, a huge population that experiences hair loss, hair thinning, widening of the part, the receding hairline, all of it. What are you seeing on your end in terms of just the hormonal changes that are happening to this population and why hair loss is occurring?
Yeah. So first of all, hair loss is occurring like an epidemic. We're seeing about 40% of our patients through the door here at Bauman Medical are female patients, and they actually come from all ages, actually. But the main issue is really happening somewhere in the like so let's say 40 to 60 years old, and as you mentioned, those are the times that hormones are changing. And so, yes, you could have hormone imbalance, during your childbearing years, like PCOS and things like that. You could see hormone crashes right after childbirth, and that's also another common trigger for shedding and so forth. But really, hereditary hair loss in women happens around perimenopause and menopause. And what we're noticing is that as those hormones shift, they start to develop a very recognizable pattern. And even though it's called androgenetic alopecia, which is the same terminology in men, androgenetic alopecia looks different in women. So everybody knows in men, you have a deep receding hairline, you're getting a bald spot in the crown, and you can lose all the hair at the top. Women lose their hair differently when they're suffering from that exactly same in the exact same condition. It looks different. That means what? That means that they have a diffuse loss in the frontal zone. They have a widening part line, as you mentioned, and maybe eventually they might recede the hairline a little bit. And so when these hormones shift, sometimes you get what looks like an androgen sensitivity or an androgen dominant look. And that would be that receding hairline and the thinning that's occurring. And so we often take a very holistic approach, functional medicine approach. In fact, I have a functional medicine department in my practice that will do a complete hormone analysis and we look at what's going on. We know just from the history of female pattern hair loss and the use of medications in the past that if you treat women who are postmenopause and menopausal with finasteride, for example, about 50% of them do respond. And so, what does that tell us? What we learned is that DHT, dihydrotestosterone, might be one of the triggers causing that miniaturization over time.
Yeah, so I want to talk about the hormones and the receptors that are on the hair follicle. I don't think that a lot of people know unless they come across, a deep dive or someone like you who's talking about it, that the hair follicle is its own organ. So we have all of these organs in our scalp, and they're all trying to do the best they can to grow hair. And so we have, we talk about in the menopause space, we talk about receptors all over our body. We have estrogen receptors all over our body, testosterone, progesterone, right? Thyroid. And so it includes the hair follicle. And so this is a time in women's lives where we see the fluctuations and then decline in hormones. And so that do you see that when women go on menopause hormone therapy, that does help? Or it might not be enough, but does it help at all?
Sometimes it helps, but we don't know exactly what those receptors are doing at the level of the follicle. What we do see, obviously, is how the hair is changing, whether it's changing in color or the hair fiber is changing in texture or in caliber, and then, as you mentioned, in length. So you're getting a shorter hair growth cycle. Um, we don't know exactly what those receptors are doing, except we see that the hair follicle is being affected by that, and by the presence or the lack of hormones. And sometimes it could be just a ratio of one hormone to another, I think, because look, if you had all those hormones at great levels, and then all of a sudden the female hormones drop a little bit, then you get like that. What I said before was kind of an androgen dominant situation, and that might be detrimental to the hair follicle. So as you rebalance the hormones, it does seem to improve the hair quality. Not always, but oftentimes it does. And the good news, though, there's a lot of things that we can do to affect the hair follicle function. And yeah, I mean, if everything's going nice and smooth, you got 150,000 of those micro organs, mini organs in your scalp, producing a beautifully long, thick hair fiber. But for most people, once they exit their childbearing years, it starts to change.
Right. So you mentioned high DHT levels, and I want to make it clear to the women listening exactly what we're talking about. So can you just highlight a little bit about testosterone and the conversion to DHT and also how you can test for it?
Absolutely. So DHT, dihydrotestosterone, is a metabolite of testosterone. That means that your testosterone in your body is converted into DHT by an enzyme called 5-alpha reductase. And most women have 5-alpha reductase type 1 and type 2, and that's the pathway that creates the DHT. Now, you may not necessarily have super high DHT, And along with female pattern hair loss, actually, you could have just normal levels of DHT or even low normal levels of DHT. But if you're super sensitive to it, then all of a sudden the hair becomes affected by it. So, yes, you can test your DHT levels. And most women who are experiencing hair loss may try to go and test it, let's say with a dermatologist or a functional physician. And they realize, oh, wow, the DHT levels are so low. Why am I having this hair loss? Well, it could be that you're just very sensitive to it.
But it can also be a genetic component. Like when I did the genetic test, which we're going to talk about testing, I did find out that I am very sensitive and more prone to high levels of DHT.
Yeah, oh, absolutely. You
Yep.
could have it. And so that's why you definitely want to test the levels and see what's going on. But I just don't want women to be surprised. Well, why am I having hair loss if I have
Right.
such a little DHT out there?
Yep.
Because actually, that's the more common situation,
Right.
to be honest. But the genetic testing also can reveal, as I mentioned, that the 5 alpha reductase enzymes, their activity or your propensity to have a higher activity of one versus another. And what that determines is what kind of treatment we might suggest to you. So,
Yep.
as I mentioned, 5 alpha reductase type 2, or maybe I didn't, but 5 alpha reductase type 2 is the predominant enzyme that creates the DHT. But you may also have some DHT produced by 5 alpha reductase type 1. And even though usually it's a little bit less, you might genetically be predisposed to have a more active type 1 5 alpha reductase activity. And if that's the case, then you might need something more than just finasteride, either topically or orally. You might need dutasteride, which is the other
Right.
medication that helps inhibit the production of DHT, which,
Yep.
is one of the bad guys. I mean, it may not necessarily be the only bad guy out there, but that's one of them.
Yep. Yep. So everyone listening, I want you to remember this part of the conversation when we get to treatment options, because we're going to talk more about some of the treatments that Dr. Bauman just mentioned. So, all right, genetics and menopause, hormonal changes. What are some other possible causes of hair loss?
Well, there's a laundry list there, a huge list of things that could dysregulate your hair, and it does seem like hair follicles in our female population might be more sensitive to all sorts of influences. So don't forget your toxin exposure, your UV exposure directly on the scalp. If you have any kind of scalp inflammation or irritation, that's not providing a great environment for your hair follicles. In fact, if there's a lot of inflammatory factors or healing factors around, sometimes that can degrade the quality and the quantity of your hair right off the bat. So those are like extrinsic things that we do to our hair, like pulling and tugging and tightly braiding it or attaching hair extensions. Those can also cause degradation of the hair follicles over time. So you have to be careful in terms of your styling regimen. The exposure to heat is more of an issue on the hair fiber itself, which makes it more prone to breakage once it's degraded, and chemicals like coloring and straightening, perming, and so forth, relaxing treatments can also degrade the hair fiber. So remember, for your listeners, the fiber is not alive. It cannot self repair. You can try to chemically repair the fiber, but it's never as good as new. And so once you've broken the fiber or degraded that cuticle of the fiber, it becomes more prone to breakage. And then you just have to wait for the hair to regrow, essentially.
Right.
But the follicle is also sensitive to so many things internally. So we mentioned hormones like female hormones, male hormones, thyroid is another one. Certainly, metabolism and nutrients and fuel are critically important for your hair follicles. So it's one of the most highly metabolic cell populations in your body. In fact, during this time of the podcast, let's say if we're on for an hour, maybe you've already grown 6 feet of hair in your scalp, and that's because you have so many hairs growing at a certain rate. So it's a very, very strong metabolic commitment. So if you're on a caloric restrictive diet, or you're on some let's just say fasting regimen, let's say, or you're on a GLP-1 agonist like Ozempic and all of those other semaglutide like treatments to try to lose weight, what happens is your body triages your nutrients now in different ways. And so it may not necessarily triage nutrients to your hair follicle. Now, follicle is kind of a luxury item, the last in line at the cafeteria,
Yep.
so to speak. So, if your body thinks it's, quote unquote, starving or in a catabolic state, then you may not necessarily grow good hair. Of course, there's lots of medications that could disrupt the hair follicle function. So even things as simple as birth control can throw the follicles off. But blood pressure medication, mood modulators, like antidepressants, cholesterol medications can all influence the follicle, and also scalp health, like the amount of sebum your scalp produces, the oil that your scalp produces. If you have whole body inflammation, you could have an attack on the hair follicles and at the level of your scalp, like a psoriasis breakout. We talked about things influencing your scalp from the outside. Don't forget about the microbiome of the scalp. If that gets dysregulated and you have an overgrowth of fungus, for example, that's not so good. Seborrheic dermatitis triggered by fungus, and that can cause a lot of inflammation. And so there's a lot that could be going on. Stress, cortisol, not good for all the organ systems in our body. If you're dysregulating your sleep, you're on a night shift or night float work, or there's something keeping you up, like a dog or a partner, perhaps in the middle of the night snoring, that can also be not so good for your hair, believe it or not. So those are really, really, the primary important things typically that we see when it comes to what can go and dysregulate your hair. If you have problems with circulation, obviously to your scalp, that's going to be another big issue too.
Yeah, typically it's never just one cause. It's a multi-layered cause, and it's really hard to pinpoint exactly which one is going on. Except I would say maybe for someone going through chemotherapy, right? Then that's an obvious cause for hair loss.
Oh, well, obviously, yes. And so also if you've had like surgery to your, let's say you've had a brow lift or a facelift, you've had a
Hmm.
surgical intervention, or God forbid, something traumatic, you bumped your head, car accident, hit by a bus, terrible. But, if you've got a scar or healing area on the scalp, it does not produce hair on its own. And so it's very, very common to see that kind of scarring alopecia occur after surgery. And so, of course, it's very obvious that that's not something internal, but an external injury that caused
Yeah.
the scar tissue.
Yeah, there's a type of hair loss called alopecia areata, which is the autoimmune condition of hair loss. And I was recently reading that there's now two FDA approved medications, and I was
Three.
three. Oh, okay. And so, are these standalone remedies for hair loss, or do those have to be also layered with other approaches?
So I'm glad you brought up autoimmune alopecia, because that's totally separate and different than what we just talked about,
Right,
androgenetic alopecia. And sometimes when people hear alopecia, they immediately think of someone who's completely bald or
right.
who has a large patch of baldness. For men, sometimes it happens in their beard, and for women, it can happen on their scalp, and it can happen even as in your teenage years. And so when autoimmune hair loss occurs, basically what's happening is your follicle has lost its immune privilege, and so your body attacks the follicle, shutting it down. And so the treatments for those conditions are completely different than all the other things that we just discussed.
Right.
um, Basically shutting down your immune system, or trying to modulate your immune system just like you would if you had rheumatoid arthritis, is the goal of what we call JAK inhibitors. JAK, that stands for Janus kinase, which is an inflammatory pathway in the body. And so these miracle cures for alopecia areata, totalis, universalis, even alopecia areata, and patchy hair loss,
Mhm.
all are in that same category. And so I guess I'm trying to think. Baricitinib, I think was the first one. That was Illuminant. And then the second one was recently approved. Escapes me. I think Lexelvi is the other one that was like 3 weeks ago. That's another JAK inhibitor. The point is that these medications are very effective. They basically, eliminate that autoimmune condition, or tamp it down significantly enough so that you get dramatic regrowth of hair in those alopecia areata conditions. But they do come with some significant downsides. Now, the researchers say that they've never seen any significant or severe side effects, but these come with black box warnings. So it's very, very concerning for patients. If you're thinking about cardiovascular injury, cancer, death, I mean, that's what's on the side of your cigarette box. I mean,
Right.
and it's the same on your JAK inhibitors. And all of the drugs in that category have the same black box warnings. So it's something you want to definitely discuss with your doctor. And they can also be very pricey as well. I guess
Well,
the interesting thing is that there's only about 300,000 people in the U.S. that are affected by alopecia areata, and and now there's three drugs for that condition. So we'll see what happens.
yeah, so I'm glad we spoke about that because, like you said, that is a totally different bucket than the medications and other modalities we're going to be talking about for a specific, midlife woman. Um,
Hmm.
Before we get into all of the treatments, I want to talk about testing. So you mentioned things like taking certain medications. So if I'm a person and I know I'm going to have to take a certain medication and that one of the side effects could be hair loss, and I know that, X amount of relatives on both my mother's side or my mother's and my father's side both have balding or hair loss issues, I might want to be proactive and I might want to go maybe seek out that genetic test or get other testing done to just sort of start my hair loss to hair regrowth preventive routine. What are your thoughts on that?
It's such a smart thing to do. If you think that you've got hair loss literally in the family, like you're looking through your family album, you're sitting around at the family picnic, and there's a lot of folks with thinning hair or receding hairlines or men with bald spots. You really should take a early and aggressive action. And what I mean by that is an evaluation. And so, yes, the genetic testing can help, but what I would say is you need a measurement because everything is done by the baseline measurements. We can do a measurement of your scalp. And the reason why this is important is because you can lose 50% of your hair density in a particular zone, and it will still look about normal to the naked eye. And only under very, very harsh lighting conditions does it look different, does it look thinner. Now, but of course, what that means is that you can lose a boatload of hair before you even notice that you've lost the hair. And that's also why a lot of women, for example, don't necessarily get a lot of, let's just say, sympathy from a dermatologist because they don't look like they're going bald per se, even though she says, "Oh, my ponytail is half the size. I'm seeing a little bit more of my scalp shining through." And the dermatologist might say, "Oh, well, you got plenty of hair left. Don't worry." But you and I know that if you're seeing the shedding in the drain, you're seeing that scalp shining through. It's a 911. So before it
Absolutely.
gets to be a 911, let's do some basic measurements. And one of the things that we have in the office is an AI powered microscope. This is my favorite tool because within minutes, I could take a snapshot, a microscopic photo of your scalp in the good area or the area that's mostly permanent, like in the back of your scalp. And I can compare that to the crown area, which is, near the swirl in the back. And I can compare that to the frontal zone, which is the most commonly affected area in women, and also in the temples too, while we're at it. And in minutes, I'll get a density measurement, meaning the numbers of hairs per square centimeter, and it will also quantify exactly how thin or thick every single hair is on that photo. And so that'll immediately tell us a lot of data, your average hair width in different zones. It'll tell you the density, front versus the back. And so we can make some very, very strong assessment and comparisons right away in that initial visit so that we know if something has gone wrong or if you're maybe more prone to hair loss in one area, just how bad it is right now before it's even noticeable.
I also think that collecting data, especially when a woman is on their menopause journey, is so important. We talk about DEXA scans or in-body scans, right? Are you measuring your bone mineral density? Not waiting till you're 65 or 70, but getting it done when you're, 50, even if you don't have any risk factors. Just get a baseline. So I really love this approach because you're getting a baseline of what your scalp looks like with your hair. And when you do choose to go on a treatment, you can then go back and see, is the treatment working? Well, you're going to know because you might see some hair, but some treatments are going to give you more hair growth per square centimeter than others.
Absolutely. And you know what? Early hair growth from a treatment can be very subtle. I mean,
Hmm.
and I know, look, we know that women, quote unquote, inventory their hair 2 dozen times a day. And so what does that mean? It means that you're touching, you're feeling it, you know what's here and there. But I will tell you that it can be very difficult to assess within the first few months exactly how much improvement you're getting from a regimen. It could be a regimen that you get over the counter at the supermarket, or it could be something that you've purchased online, like a nutritional supplement. Is that really working for you? Well, most people we find discontinue those treatments before the results are even
Yeah.
noticeable, but yet they were measurable at the earlier stage. So that's why, even if you're going to choose a non medical therapy, and we have a lot of non medical therapies in the practice, which I'm sure we'll talk about, we want to know how the hair growth is being affected in different areas of the scalp over time. So in just quickly as 90 days, you're
Yeah.
not going to see it in the mirror, but we can measure it so we know what areas are responding and how well and where those areas are.
Yeah, I did this with my son. We have who Karen Gordon in Chicago, and she's a wonderful trichologist. And she was trained by you. And it was very interesting for me because I've been on a hair loss journey for 25 years to see the magnification of the hair follicle, the miniaturization that you were referring to. It's really just an incredible way to dive deep into collecting more data about your hair health.
Oh, absolutely. And,
Yeah.
and it's not just the AI measurements that we get with the microscope, but there's also cross-sectional bundle measurements, which is like,
Mhm.
you're feeling your ponytail, it's going down. What if you could make a scientific ponytail in very specific areas? We could measure that over time. And that's also a very sensitive measurement that literally takes 5 minutes, not a big deal.
Right.
Many patients pop in, pop out for that kind of measurement every 90 days in the practice. They just stop on by, get their hair check measurements, and then they go about their business. And it tells us exactly what's happening and where.
How many hairs are we supposed to be losing a day? Because the pull test, this is a great test just for at home if we don't have access to you or a trichologist. What's that number?
Yeah. So because you have about 100 to 150,000 hair follicles on your scalp, and because they cycle on and cycle off over time, that means each hair follicle turns on for a period of time, usually about 5 to 7 years. And then it will spend 90 days basically going through a degradation and a resting phase before kind of rebooting, if you will, and producing a new fiber. Every single day on your scalp, there are hair follicles that are turning on and turning off. And when a new hair pushes out an old hair, that's a shed hair. That's called exogen. And so if you are brushing your hair, shampooing your hair, doing your stuff every single day, you should see about 100 to 200 hairs. That's actually normal. Let's call it about 100. But here's the thing that a lot of women don't realize. That once they start to see an excessive shedding phase, sometimes they feel like they're all of a sudden their scalp is fragile. They don't want to brush it or shampoo it. And then you go days and days and days without manipulating your hair. And then when it is time to kind of, get organized and shampoo it, all of a sudden it's like, oh my God, there's enough hair to like, choke a cat. It's like clogs the drain. Well, if you lost 200 hairs a day, let's say you have a decent head of hair, and you didn't, comb it out for 5 days, that's up to 1,000
Yep.
hairs in one fell swoop. And especially if your hair is shoulder length, man, that could look like a boatload of hair. That's going to fill up a Ziploc baggie for sure. So that's not concerning. When people come in with the baggie, I always ask, well, how many days between shampooing and brushing is this collected, right? Because that's a critical piece of information. So the point is that if a hair is growing, it doesn't come out of the scalp so easily. You actually have to like pluck it, like tug on it hard to pluck it out of the skin. And if you don't believe me, just grab a hair on your arm and try to pluck it out. That's not so simple. But a hair that's not growing can be brushed out quite easily. It just comes out when the brushing or the shampooing. And so no, you can't cause hair loss by over shampooing or over brushing your hair. In fact, probably scalp hygiene would improve if you were shampooing a little bit more often. So I know that was a long answer to a short question. So 100 to 200 hairs a day is normal and natural, but remember the caveat. You have to be, that's with brushing and shampooing every single day.
Right. I am so glad that you did spend time on that answer because it's a myth out there. I can't tell you how many times I hear women say that their doctor told them not to shower, not to wash their hair more than twice a week. And if you're going to lose your hair, it's coming out. Like you said, not brushing it is not going to help the situation at all. And also, I've learned from both you and Karen that scalp health is so incredibly important, and that not washing your hair and working out and being exposed to toxins in the air, wearing a helmet, wearing a cap, whatever it is you're doing, is making the soil. But if we call your scalp your
Yeah.
soil, it's not functional for hair growth.
Correct. And, again, everybody's scalp is different. So there's no recipe that's like
Right.
a cookbook. You look up and go, oh, every other day is fine. Why
Yeah.
do you think there's so many different types of shampoos and conditioners in the supermarkets? Because there's so many different hair types,
Yeah.
and everybody's skin is different. So the scalp you had as a teenager and in your 20s is different when you're in your 40s and 50s. And everybody, men and women, we just dry out as we get
Yeah.
older. We just produce less sebum typically. Um,
Yeah.
and some people go the other way, to be honest. Some people have excessive sebum production, and that's okay. So if you're on the side of excessive sebum production, you might need to shampoo twice a day, especially if you're working out.
Yeah.
But if you're more on the dry side of things, then maybe you can go a couple of days. If your hair is super curly and coarse, if you have maybe afro textured hair, you're going to need a deep and durable conditioner, one that lasts a long time. Well, if your hair is thin and kind of straight and wispy, and you use that same conditioner, it's going to look like you're a drowned rat. It's going to be so flat. So you need a lightweight conditioner on the other side of the spectrum. So there's so many different variables, and that's why having a trichologist is so important. We have
Yep.
an entire trichology department in my practice in Boca, and they're working all day long, looking at people's scalps, trying to guide them on correct scalp hygiene, exfoliating the nasty dandruff and flakes and stuff, and dealing with seborrheic dermatitis and applying different therapies and treatments, to really rectify exactly what you said. The soil in the garden
Yep.
is critical if you want to plant a seed. That's what I would do in a hair transplant, or even if you just want your existing garden to flourish.
Yep. Such important information. Let's move on to treatments. This is the juice of the podcast, and this is something that you just shine at. I was thinking about putting them into different buckets, maybe starting with topical treatments, oral. And I know what I do want to make sure is that we cover for women who want a more natural approach, right? They're, for
Mm,
some reason, they've read something or have made a decision in their mind that they do not want to take medications. And I do want you to talk to that woman here. I
sure.
want you to assure them that, are the medications doing harm or are they not doing harm, right? Why are people believing that taking medications for hair growth is not good for you? And then I want to offer science-backed non-medical treatments as well. So um, I know I made some buckets, but however you feel is the
Yeah, I mean,
easiest way.
I think it's normal and natural today for both men and women to think, hey, there's got to be some kind of natural cure or some non-pharmaceutical option here for
Yeah.
hair regrowth. And the good news is that there is. So there are some good treatments that are non-chemical, non-invasive, non-pharmaceutical that literally have no side effects. And so it first starts with that evaluation that we talked about, taking that comprehensive 360, functional approach, if you will, just to make sure that our risk factors are kind of handled in the beginning. Because again, if your scalp health is a disaster, all of this other subtle stuff that you're going to do is going to be like pushing a boulder up a hill. It's going to be very difficult.
Right.
But let's just talk about something that's simple and easy. I mean, obviously, there's some nutritionals and nutraceuticals that you can find online. Some of them are very, very well known. Some of them we curate here at Bauman Medical. I'm a huge fan of Nutrafol. And it's no surprise that we were one of the earliest adopters of Viviscal 20 years ago when it first came over from Europe. And these are, as you said, science-based nutritionals. They have some good science in the peer-reviewed journals behind them. And so that's what I look for in a nutritional supplement. And obviously, I've designed my own line of supplements called the Bauman MD Nutri Team. And there's a variety of different things, making sure you're adequately protein, that you're fed with protein, making sure that your protein's sufficient, right? Whether with collagen, and that you're not deficient in minerals or vitamins that are specific for hair growth, the B complex in particular. Biotin also helps with hair quality and quantity. And then there's other nutritionals and nutraceuticals too, like if you're stressed out, should you be using an adaptogen to mitigate and make yourself more resilient to the effects of stress? Should you be using some kind of stem cell support nutritional? Those are all things that we can do. Probiotic to lower a whole body inflammation, things like that, right? But let's talk also about the non-chemical, non-invasive treatments that you can do at home, like low-level laser light or photobiomodulation. And if you had said to me after I graduated medical school in the 1990s, hey, can you tell me about how red light affects the skin? I would have looked at you crazy. I mean, I would have been, they didn't teach us that in medical school back in the 1990s, that red light has a very potent effect on skin and metabolism and has an incredibly powerful cellular effect. Obviously, today we know different. Low level laser light therapy has been a part of my practice for over 20 years. And we know specifically today, you want to talk science and mechanisms. We know now what we didn't know in the beginning is that certain wavelengths of light, especially visible red, which happens to be between 650 and 670 nanometers, gets absorbed by the mitochondria. Mitochondria, by the way, are the energy producers inside all of your cells. We've already belabored the point that hair follicles use a lot of energy. And so when the red light hits the membrane of the mitochondria, the electron transport chain creates more ATP, which is the energy currency in the body. And when you have more ATP, your body and your cells function better. So there's no question today, these certain devices are better than others, but low level laser light therapy is a hair growth tool. No question about it. Now, a lot of folks want to know, well, is there a difference between the consumer versions that you see on Amazon, available on eBay or whatever, or late night infomercials versus the more medical grade devices? Well, yeah, you betcha. Just like buying a TV with more pixels, more diodes is going to get you more power. And so a big clunky, bicycle helmet type unit might be a little bit cheaper, but it may not even actually have any kind of lasers in it whatsoever. It might just be LEDs, just red light
Right.
bulbs.
Right.
So, something more powerful and portable like the Bauman Turbo Laser Cap might be a more prudent choice, especially hopefully you just buy one of these in your entire life and hopefully you're set, right? So it's one of the least costly treatments over time if you do it right the first time.
I just had Dr. Rabin on last
Oh,
week.
awesome.
I haven't seen him in a couple years, and I use his cap, his laser cap
Yeah,
HD Plus, which I love. But you're right. You know, a lot of people go on to Amazon and they might find something for $150, and that might be their budget. But I would say just don't even bother buying that version because it's not going to do what you want it to do.
correct. No, Dr. Raven's been a close friend since in
Yeah.
2008. He ran into me at the International Society of Hair Restoration Surgery, and he brought me this dome-shaped item with lasers inside of a baseball cap, and he says, "I've talked to 20 people, and they all say I should go to you with this device." And I would say, "Yes, I'll take a case of them. Here's my credit card." And
Mm-hmm.
he's like, "Well, this is the only one."
Yep.
I said, "Well, when you get around to making them, send them to me because I have thousands of patients who will be able to use this device." And so I was instrumental in doing the clinical research. In fact, my original clinical trial coordinator for our laser trials ended up being my patient advocate many years later, and she just retired into motherhood. But I worked very closely with Dr. Rabin and his amazing team. Harvard researchers,
Mm-hmm.
MIT optical physicists to design and bring to life the turbo laser cap in its current iteration, which is the most powerful, most portable, low level laser light therapy device for hair regrowth on the planet.
Yeah. And you're right. It's an investment. But the thing about hair loss, especially androgenetic alopecia, which is what I have, is that it's a lifer. It's not going away. And so
Mm,
for me, making that investment and knowing that I can wear something for 20 to 30 minutes a night, at least 5 nights, even though I try to do 7,
hmm
is for me, it's a easy investment and it's an easy protocol to follow. I get in bed at night, I read my book for 30 minutes while I have my cap on, and that's it. I'm done.
Well, Jill, I mean, I'm going to have to send you a turbo laser because it's 5 minutes. So I've just saved you
Oh,
15 minutes
okay.
of treatment every day. So,
Awesome. Great.
yeah, it's a 5 minute device,
Yeah.
which is one of the reasons why we call it the turbo, not because it has a fan in it, because it's
Right.
speed.
Yeah. 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 So I wanted to circle back to Nutrafol and other types of online nutraceuticals that are being sold and how women can decipher if what someone is selling is really going to produce the results. Now we know Nutrafol invests in a lot of trials. I don't know that I used to take Viviscal. It didn't really do so much for me.
hmm
Um, but I don't even know if they have clinical trials behind that product. But how can
They do.
people avoid being sucked in by the marketing?
Yeah. Well, there's always a TikTok trend, this oil, that
Yeah.
oil is, with all the hair growth. And unfortunately, what happens is that there's one little study, very underpowered, and it makes some news. Last week, it was some sugar thing with deoxyribose. Um,
Yeah.
and there's always something different that's going to come out. And unfortunately, most of these like buzzy type of treatments, there's some studies that were done in mice, and that's kind of the end of it. So you want to really look for human trials. You want to look for human hair follicle or in vitro trials also. Those are super helpful to kind of decipher. Look, every physician is going to have their preferences. I was around when Nutrafol, did their first, supply, so to speak. I have the oldest packaging from the Nutrafol sitting on my desk over here because in 2016 I was one of the first to prescribe it, to recommend it, to patients and to carry it
Yeah.
in my office because I met the inventors. I met the three founders, and I knew their attitude, their professionalism, their goals, their background, and their dedication to creating something that was good and to do something science based. Now,
Yeah.
they have to continue to impress us because as companies grow with additional funding and things like that, I know they still have a hand on the tiller, which gives me a lot of confidence that they're just continuing to improve the product that they have. And I know that they use proprietary ingredients, and I think that's important
Yeah.
because let's just take an ingredient like curcumin or turmeric or something like that. There's a lot of different ways to get curcumin and turmeric into a capsule, right? And unfortunately, many of the products that are out there, and we just saw a news report on this, adulterated with some kind of toxin that was literally in the turmeric. And so it's just an awful situation. But if you have a proprietary mixture, at least you know that somebody's kind of at least watching, hopefully watching the how it's being produced, and there's some consistency and some quality controls that are going on, because someone's hanging their name, their hat on that,
Yep.
so to speak, and the clinical trials and research is being done on that proprietary formulation. So somebody's got some skin in the game, to make sure that it's the right thing. I think
Yep.
that's how I look at it. Is it going to be, $100 million clinical trial like a drug company? No. I mean, let's be honest. You're never going to see that in the supplement world
Right.
unless there's something that they can patent. But we do the best that we can, and patients do get an effect. They do get a nice effect from Nutrafol. In fact, because I think it's like a salad of herbs. It addresses hormone imbalance, it addresses inflammation, it addresses stress, it addresses circulation and
Hmm.
nutrients and fuel. And so there's a lot of components in those 4 capsules, which is why you got to take 4 a day. But
Yeah.
I don't want to make it a commercial for Nutrafol, because certainly
Right. Totally
I'm
right.
not I'm
No,
not
but I
involved with
think
the
it's,
company, but I
yeah.
do have a lot of faith in it. And I think it elucidates how, as physicians, we should evaluate these things
Yeah.
that people really do need and want. Now, once you've been on Nutrafol and you've measured some nice improvement, the question is, what can we do next? Like, what's the next step? And this may require something like a medication, perhaps, or something more invasive than something you would do at home, or a visit in the office. And so that's where I think the pharmaceuticals come into play, like, for example, minoxidil. And I'm sure you would want to get to that.
Yeah, for sure. Are you done talking about the more natural? No, we haven't gone over PRP. That's
So
in this
PRP, yeah,
first bucket.
PRP is in your natural bucket because
Yep.
it is autologous. That means it comes from your own body. We're leveraging your own platelets. Yes, it's a little bit more invasive, meaning I've got to take a little bit of your blood. And we also have to apply it. I would recommend applying it with local anesthetic, so it's painless instead of painful. That's just our way of doing it. And so
Right.
PRP, unfortunately, is kind of like cookies. Everybody makes a different recipe, and some people have more chocolate chips in theirs than others. You know, I don't eat a lot of chocolate chip cookies, but the ones that I do like have a lot of chocolate chips. And so my PRP, just to continue that analogy, has a lot of platelets. And we deploy about 11 billion platelets per treatment for each patient when we do PRP in the office. It's a 1 hour treatment. There's no recovery, no downtime. Your worst case scenario is that your scalp is a little bit pink after it's all said and done, very numb from the local anesthetic that we use. Sometimes you can have a little puffiness in the forehead, especially if you've recently had Botox. But other than that, you're back to your regular routine. Shower, shampoo that night, and off you go. So and the way that we do the PRP is very special. It actually gives because we use so many platelets and we're also using a dual spin protocol, it also contains what we call leukocytes, or the white blood cells, the monocytes, which I think are very powerful and rejuvenating and regenerative. And they're a very, very key component to this regenerative medicine treatment. And when we do all of that together, the proper recipe, the chocolate chip cookies came out really good. No, I'm just saying the hair growth is going to be 10 to 14 months a boost before you need another treatment. So there's some other nuance in there
Oh,
too. Actually,
so you do it where it's just one treatment versus 3 months in a row. And okay.
yeah,
Because your proprietary mixture is so potent.
yeah. I mean, it's not proprietary. I lecture on it. I teach it
Oh,
all
okay.
the time. It's
Okay.
not difficult. For practitioners or physicians that are listening, they can go to hair coach class and get certified in how to do this. The weird thing is that I've certified hundreds of people on how to do this process, but then I find out later that they go back to the cheaper way, the triple treatment with a little tabletop spinner. You know, unfortunately. So when you cut corners on PRP, that means you have to do it more often, and you don't get as many platelets, so you don't get as big of a response in the skin.
Also, after PRP treatments, do you recommend using the red light therapy just to reduce the inflammation?
So we treat with low level laser light therapy before and after all of our
Hmm.
PRP patients in the office. Now, do patients have to go home with a laser? No, you don't have to.
Right.
Would it be helpful? Of course. Why would it be helpful? As you said, reducing inflammation,
Hmm.
increasing circulation. We
Hmm.
talked about the fact that it enhances ATP production in the scalp and in the follicles. So you're definitely going to get a better result as you start layering these non-redundant therapies together. So you start to build a nice stack, if you will, or regimen from the least invasive, no side effect treatments to things that require a little bit more effort and energy, depending on your situation.
And so what's the cost for a single PRP or a roundabout
Yeah.
cost?
Yeah. So our PRP treatment is going to be in the $3,000 to $4,000 range, which is the same as what we do for Alma TED, which is a series of 4 treatments.
Yeah. Let's talk about almond's head because that is my favorite modality to use for myself. And of course, you and I both know Dr. Dye here in the
Yeah,
Chicagoland area.
sure.
So
She's
I
the
love
TED pioneer.
totally, right? I love the TED. I want you to describe what it is, but I love it because it is absolutely pain free. There are zero needles involved.
Yeah, so TED, transepidermal delivery, uses a technique called sonophoresis. Now, this is not a new concept, but using ultrasonic sound waves, so nothing else but sound waves, vibrations literally, to push topical serums through the skin. Now, you would say, why would you need to do that? Well, the ultrasonic waves disrupt the stratum corneum, which is the moisture barrier. So when you wash your hands, they don't swell up like a sponge and the water runs off, hopefully. And the reason for that is the stratum corneum. So that tiny protective layer under the skin is a moisture barrier. It also keeps out microorganisms, which is good, but it also keeps out large molecules. And it also slows down the absorption of many things. Even local anesthetic doesn't absorb very well when you apply it topically to the skin because of the stratum corneum. So, but ultrasonic sound waves, specific frequencies and pressure waves disrupt the stratum corneum briefly, if you will, and then allow us to push these serums right through the skin. So often people ask, well, what are you pushing through? What is being
Mhm.
applied to the scalp? And this is where it gets really exciting because we're using this combination of growth factors and peptides. So peptides like copper tripeptide, copper GHK, fibroblast growth factor, thymosin beta 4 derivatives like proherin B4. Those are all, and VEGF especially. And there's actually dozens and dozens of things in the serum, including essential amino acids and exfoliants. And also, the serum is very, very specific to conduct those sound waves down into the stratum corneum to produce that disruption. So the TED serum is actually like kind of miraculous. It was most people don't realize it was finely tuned by a company in Italy called Monta Research, and their exclusive goal is to try to deliver drugs into the skin. That's like
Mhm.
their mission statement. So drug delivery is that's their sweet spot, and I think they've got it because these biomimetic growth factors and peptides, which means that they're naturally occurring items, non-pharmaceutical items, can be pushed directly through the skin without a needle during a treatment that takes about 30 to 40 minutes at the
Right.
most. And I've had it myself. I love it. It's very relaxing. It feels
Yep.
like a hot stone massage on the
Mhm.
scalp. And unless someone's talking to me, usually I'm dozing off when
Yep.
I'm getting the treatment done. And so that treatment requires 4 visits, meaning once a month for 4 months. And sometimes patients elect to speed it up and they'll do it a little bit closer together. Other folks do some travel in between. They have to spread them out a little bit. But basically, once a month for 4 months is a good way to get the results that we saw in our pilot study that we did with the TED device. And it's just been spectacular. We presented those results in Paris at the IMCAS and many other places, actually, all around the country, from A4M to dermatology meetings and so forth. And of course, many webinars. So very exciting technology, great tool to have in the practice. And many of my colleagues I'm finding are starting to adopt and grab on to the TED treatments. And in fact, we're using TED now along with exosome therapy
I
to
was just
deliver
going to ask you
exosomes.
that. Tell us about
Oh,
that.
yeah. So I'm not sure if your listeners or followers are familiar with exosomes, but basically, exosomes are the messages that come from stem cells. They're little packets, very tiny nanoparticles, 1/1000th the size of a cell. And they're used for cellular communication. All cells actually give off exosomes, but we like the ones that come from mesenchymal stem cells. Those are the ones that are most powerful for tissue regeneration and repair. And what we've known is that topically applied exosomes can dramatically accelerate healing. And that's what we use them for sometimes with hair transplantation. We've also found that soaking hair transplant grafts in exosomes, we think, is speeding up the recovery process, but also encouraging early growth from the transplanted follicles. So we're in a little study with that going on right now. But the pilot study that I was going to tell you about was using these Juvexo exosomes in conjunction with the TED treatment. And so, you have to stay tuned for the results. We're doing all of the evaluations, as I mentioned, with AI powered microscopes, the cross sectional trichometry, and of course, global photography,
Hmm.
microscopic photography. So we'll be tracking these patients 6 and 12 weeks out from the procedure, and then on for a full year afterwards to see what the response is from the therapy.
Yeah, I am a huge fan of the TED procedure. Like I said, I had the same experience as you. It was very relaxing, zero needles if that's something that you are, triggered by, and you see results really quickly.
Yeah. I
Yeah.
think it's more repeatable, and
Yeah.
I try to tell my colleagues when they ask me about, well, what about how's it going to compare to my PRP? Well, the first of all, I want to find out what kind of chocolate chips they're baking, right? And so,
Mhm.
if they're not doing a really high quality PRP, or for some reason they're limited and maybe they're staffing and so forth, the TED is a little bit more reliable, so it's a little bit more consistent in that way. Now, of course, if you have a nuanced PRP, I think like we do, of course, I have a lot of confidence in that after nearly 20 years of doing PRP and over 14,000 PRP treatments provided. I think, it just kind of depends on the situation. And some patients will actually do both, not on the same day, but they will overlap those therapies and treatments. And I have some patients that come in just every month for TED. They love it. Just like they were
Yeah.
scheduling a facial or a massage, they find it relaxing, 30 to 40 minutes. They can kind of forget about their world for a moment and also do something healthy for their scalp and their hair.
Right.
And I have to tell you that in our pilot study, we saw some repigmentation too. So that was super exciting, with the TED, that maybe the
Hmm.
copper peptide is having some beneficial effect there on the pigmentation, the melanocytes within the stem cell population in the follicle.
That's amazing. I am going to look forward to that research. Let's switch over to the pharmaceutical bucket.
Okay.
So we know that minoxidil, topical minoxidil is the only FDA approved medication for female pattern hair loss, correct?
That is correct. But
Yeah.
it's not the only tool in the toolbox.
Right,
So
right. I'm going to let you take it from here because I know you are so good at explaining all of this.
yeah, I mean, look, minoxidil is the OG, the
Yeah.
original treatment for male pattern hair loss, and then, of course, for women as well. Originally FDA approved as a 2% solution on the scalp, and then eventually a 5% solution. Minoxidil, notoriously, however, has a large cohort of patients. If you go to the supermarket and you buy Rogaine or generic minoxidil, Costco, whatever, or even from a cloud pharmacy, very often you're getting that basic recipe, which is minoxidil plus propylene glycol. And the main problem with that, um, first of all, that's the original recipe, so that was what was FDA approved. Anything that's sold over the counter has to kind of toe the line in terms of being close to that recipe. If not, they can actually, be shut down. But the point is that propylene glycol is a very common irritant. Not everybody can tolerate propylene glycol. So, 30% of folks who just try over the counter Rogaine get a nasty irritation or this greasy feeling. And if that's what's going on with a treatment you've got to use twice a day, not so good. You're not going to be compliant, no matter how good it
Right.
works. Right? It's not going to be good. Originally approved, like I said, 2% and 5%. So the newer treatments that I would say in the minoxidil realm are things like Formula 82M. Formula 82M is a proprietary recipe that is then licensed to compounding pharmacists. So physicians need to prescribe this.
Right.
In order, you can't just go to the store and ask for Formula 82M. You're not going to get it. So you
Right.
have to go to a physician who has the relationship with the pharmacy and they can prescribe it to you. And there's only one pharmacy in the country that's allowed to make this proprietary recipe. And the recipe is minoxidil plus fluocinolone, which is a mild anti-inflammatory, plus tretinoin, which helps with the penetration, and another little thing too, which I'll tell you in a moment, in a very, very user-friendly, scalp-friendly base. Now, remember, I mentioned that like 35% of people get irritation from the old propylene glycol version solution over the counter. Well, there's also another cohort of people out there, maybe about 30%, that just they simply don't convert minoxidil into minoxidil sulfate all that well in the skin. And there's another specific enzyme that does that called sulfotransferase. And if you're born with low sulfotransferase activity, it's a genetic condition actually that we can track through pharmacogenomics,
Hmm. Yep.
then you can slather like crazy Rogaine or generic minoxidil, and it won't have that great of an effect on the skin until you add a sulfotransferase booster. The tretinoin not only helps the penetration, but also boosts that sulfotransferase enzyme. So that's why most people with a prescription topical like minoxidil will do better. Now, what does minoxidil do? Minoxidil is a anagen stimulator. That means if the follicle is turned off and you want to turn it on, the minoxidil will help do that. It's also an anagen prolonging agent, so it keeps the follicle in the growing phase longer. And so the more consistently you use it, the more that those follicles will turn on and stay on, meaning it's going to grow a longer, thicker, stronger, healthier hair over time, and hopefully combat that natural miniaturization, which is the opposite effect, where the cycling is getting shorter and shorter and shorter over time. We want to reverse that. We want to make the follicles grow for a longer period of time and a thicker hair as well.
Yeah. So
that's the basic minoxidil application,
yeah,
right? So we talked about the generic over-the-counter cloud pharmacy,
right.
and then we've got these nuanced prescription items, which are from physicians, and then of course the tracking goes without saying, and then we also have minoxidil now orally.
Yep.
So oral minoxidil became well, it was the original thing because that's how they discovered minoxidil was a hair growth stimulator way back when. It was used as a blood pressure medication for people on dialysis, essentially. And they got what they call hypertrichosis, which is basically you turn into Sasquatch. No, you get extra hair growth in other places. And some clever folks at Upjohn who were making this, making the Lanatin, which is minoxidil orally, decided, hey, this side effect would be a great treatment for baldness. So let's put it into a topical. And that's how they got Rogaine. But today we can use a micro dose of prescription minoxidil off label from a compounding pharmacy. Daily oral dosing is very powerful for hair growth on the scalp. And we want to avoid some of the side effects by using a very tiny dose. And it's been very, very effective for men and for women. But you have to dose it appropriately. You want the lowest dose that's going to give you the best result without side effects.
Right. And that could range from what, like 0.75 milligrams to 2.5, right, for a woman. So I used to take 1.75. Now I'm at a 2.5 every day. So I take 2.5 milligrams of oral every day, and I use the compounded 82M. I never actually went the topical minoxidil like Rogaine route because it looked really messy. It comes in the more of the oil, and then it also comes in the foam, and with my hair texture and everything, that just wasn't going to be an option for me. So the compounded 82M has just been a game changer. But I also want to talk about finasteride, because what you're saying is minoxidil is going to help grow your hair. But I also have high DHT, genetic predisposition to high DHT. I use testosterone cream as a menopausal woman, which I don't ever plan on going off of, right? So it helps me with my mood. It helps me with my libido. But now I take finasteride.
Muscle mass, bone structure, brain function, metabolism, everything.
So we talked early on in the podcast about this orchestra of hormones, right? So I want my hormones to all be very balanced and play in the orchestra together nicely. But I also want a lot of hair. I want my hair to grow from the minoxidil, and I want the hair to stay from not having that high DHT. So in comes finasteride. Talk about finasteride. Right.
So finasteride, we had mentioned it earlier, interrupts that conversion of testosterone into DHT. And so for women, the reason why this is important is many women don't even realize that they're prone to female pattern hair loss until they go on androgen optimization therapy, hormone replacement therapy, like you just said. So whether you're doing a pellet or cream or whatever the application is, all of a sudden they start realizing, oh my God, my hairline is receding. What the heck is going on? A lot of women will come into the office as a 911 emergency and noticing that hair loss specifically from the androgens that they've added back now into their system to optimize all the great things we just talked about. But the good news is that finasteride will block that type 2 5-alpha reductase enzyme, inhibit it essentially, and it will lower the production of DHT, which again is that bad guy that causes the miniaturization of the hair. So for many of our hormone replacement patients, both men and women, finasteride is an important tool in the toolbox. We can also, from genetic testing, elucidate whether you have high activity at the type 1 5-alpha reductase enzyme, which is, even though it's a smaller pathway, usually not as active as the type 2, sometimes in some folks, it's more prominent. It's just a bigger, service road around the natural big highway, and there's still cars going through there get into, hair loss land, and that's not so good. So
Right.
the dutasteride medication, which was FDA approved in men for prostates, not approved for men for hair loss in the US, although it is approved in Korea, South Korea, and Japan for male pattern hair loss, can also be used in women now postmenopausally. And we probably should say and remind people that finasteride should not be used in women of childbearing age because of a theoretical risk to a developing male fetus,
Right.
because you
Right.
need DHT to develop the male sex characteristics, secondary sex characteristics. So what things that make men look like men are
Yep.
DHT dependent. Um, there was that boxer just recently in the Olympics who was an
Yes.
XY pseudo hermaphrodite. So wherever they were born with XY chromosome and raised as a female because she had ambiguous genitalia at birth, but actually has male chromosomes. So actually, that was some of that work on pseudo hermaphrodites were actually was used in the development of finasteride as Propecia as the hair loss treatment. That's what Merck used as the basis for the treatment.
Hmm. Interesting. And
So
so,
he, or let's say XY, born with ambiguous genitalia, raised as a female, and then went through puberty. Maybe then testicles dropped, penis enlarged. Who knows? We don't know. Obviously, the muscle mass grew crazy because he went through puberty essentially and transitioned into a man. In the olden days, hundreds of years ago, those folks basically would leave town and then have to reintegrate back into society as a man after they go through puberty. It's not so easy to do in a Muslim country because they don't let you, change your birth certificate, so to speak, as they say.
right.
And
Right.
that's why she was allowed to compete against women in even though she had an XY chromosome. So anyway, that's just a nuanced thing that has to do with this 5-alpha reductase, because he was born with 5-alpha reductase deficiency. Essentially,
Mm.
that was the inborn error of metabolism that caused the ambiguous genitalia. So again, you don't want to have decreased
Right.
DHT or block that in utero. That's my point.
Yeah. Yeah.
Uh,
No, that's really important to know. I also want to
but no
point
side
out,
effects for women. Like, we don't have any side effects for women who are on finasteride or dutasteride. We've not seen that in the practice.
right, because a lot of women say when you take finasteride, your libido might decline. I bumped from 1 milligram orally to 5 milligrams a few months ago orally every day, and I did not. I have not seen any decline in my libido. And trust me, as a 56-year-old, I work really hard on that. So that's the good news. But also,
Yep.
finasteride comes topically. You can get 82F.
Correct. So 82F is, again, this custom compounded pharmaceutical
Mhm.
formula that is available from physicians who can prescribe it to you. 82F is minoxidil, finasteride, tretinoin, fluocinolone, and also in that very, very usable base, meaning it's a very scalp friendly, non-irritating base, hopefully.
So do you think that it's overkill and too much to do too many things? Or is it just a personal preference? When is it too much?
Well, you're talking to someone who has fought baldness for like over 25 years, developed his own product line of supplements, his own hair care regimen, has used all the pharmaceuticals that we've just talked about, including laser light therapy and TED. So, no, I don't think it's too much. I think if you care about your hair, then it's worth it. Now, if you don't care that much about your hair, then obviously, you may have different priorities. But I'm assuming if you've listened this long through the podcast, you're probably one of those people like us that care about our hair. And I think it's just evolutionarily natural to want to look good and feel good with hair. It's a sign of youth and vitality. I may not be so happy about the going gray, but if I can keep my head of hair, no, it's not too much. It's just a regimen like everything else. Keeping our exercise regimen intact, doing what you're doing for hormone optimization, and me also, doing all the things, whether it be hormones and peptides, supplementation, trying to get better sleep, optimizing the sunlight and so
Yep.
forth, and reducing blue light at, after certain hours, and kind of developing a regimen so that we can, live a longer, healthier, and happier life. And I think we're not just trying to improve the health span, but we're also trying to improve our hair span. We want to keep our hair for longer. I
Outside
mean,
of,
I grew up in a family where my dad was went completely bald by the time he was 30. His dad, my grandfather, I never met the guy with hair, and my mom's dad also had severe hair loss. So, just personally, no, I don't think it's too much. You got to take action as long as they're not overlapping treatments, right? Non-redundant therapies, but they're working differently. I think it's okay.
Right, right. And for the woman listening who maybe perhaps started listening to this podcast with the viewpoint of, I don't want to touch these pharmaceuticals. There's no way I'm going to take them. They're dangerous. What would you say to that woman?
Oh, well, gosh, we've treated, 35,000 people in the practice with these medications commonly. And so these medications are very safe. They're very effective. That's not to say that you can't have an irritation or a side effect from any kind of topical. I mean, if you go home and use rosemary oil on your scalp and that rosemary oil has been sitting on the shelf for more than a couple of weeks, you can bet it's going to cause a nasty irritation on your skin. So there's no safe treatment out there that's 100% free and clear of everything except maybe laser light therapy. But if you're going to use a medication like minoxidil, for example, it's been around long enough, 30, 40
Yep.
years now. We know it's a very good treatment. And, we monitor you for side effects. For example, we don't want you to have water retention or low blood pressure, which would manifest as headaches or dizziness or things like that. And if you have hair growth in other places, well, that can be a challenge sometimes. It is dose dependent, but we also have laser hair removal. If the hair is
Right.
dark, that seems to
Good
work
pair of
pretty well.
tweezers.
Yeah, tweezers, electrolysis, and waxing doesn't hurt. But
Right.
look, these are all things that are risk benefits that we have to choose every single day. You get in a car, you put a seatbelt on, you drive down the highway. It's risky too.
I agree. Well, thank you for sharing that. So we are coming to a close. I have a question about collagen before we close up. Collagen, yay or nay for hair growth?
I like collagen. Collagen peptides are important to support the collagen in our skin. We've talked a lot about the scalp. And so if the scalp is healthy, the collagen is healthy there. That's going to be part of the milieu, if you will, in that soil. And remember that a lot of the peptides that are in collagen make up keratin, which is literally what your hair is made out of. I mean, the protein keratin is dried keratin. That's what our hair strands are made of. So I think it's proline and leucine, for
Yep.
example, are in collagen peptides that specifically direct into keratin. And so I'm a
So
huge advocate for that,
why
as
why
well
is
as
the
with hair
science so
transplant.
weak then? There is such weak
Well,
science about around it.
yeah, I mean, like collagen as a category, I think is relatively new, and it took off huge.
Yep.
It's also there's not a lot of proprietary stuff, so people don't tend to again invest a lot of dollars, millions of dollars, like you would need for clinical trials. But I will tell you that there is a collagen peptide component to the Bauman Builder, which is our collagen peptide mixture that we use, that has some data that shows it impacts hair regrowth and supports hair follicle function. So it's not a pie in the sky wish. It is one of the ingredients in the builder collagen that we
Is
uh,
it the
that we have at the
Verisol?
practice. Yes.
Yes. All right, good. That's the one I use. It has a little bit of science, like you said, so I feel
Yeah.
better using that. Okay, good. That's great. Wow,
Yeah.
Dr. Bauman, thank you so much for such a comprehensive episode. I know that women are going to walk away from this and really think long and hard about what their hair growth goals are. I think you have to know your cause, you have to know your goal, and also your budget, right? You've listed so many different things that are categorized by so many different budgets. And also understanding that you're in it for life, right? If you,
Absolutely.
yeah.
Absolutely. Like we said before, you're trying to, maintain good muscle mass,
Mhm.
dexterity, brain function. We want our skin to be healthy. We want our teeth to be healthy. We want our gut lining to work right. I mean, hair is just another outward sign of our inner metabolism. And so that's why it's so valuable. It's sensitive to all these things. And that's why when you're optimized and your hair is doing great, you feel great. And sometimes it works the other way too. Listen to your scalp, listen to your hair. If something's happening up there, sometimes that's the first sign that we may need to dig a little bit deeper into what's going on. And it is hair loss awareness month, so this year we're saying time equals follicles, and that means early intervention is critical. As we started the podcast, with the knowledge that 50% of your hair could be gone without you realizing it or noticing it from across the room. So it's important to get on top of this early, because once a follicle is beyond repair, the only thing that's going to replace that follicle is a hair transplant. And so,
Right.
if you might need, and a lot of women with aggressive androgenization, if you will, or or patterned hair loss where their hairline is receding, they might need hair transplants to fix those areas. And certainly we do a lot of replacement in those locations, as well as for scars and plastic surgery issues. Eyebrows, eyelashes are also common in women that we replace, restore with transplantation as well. But you want to try to avoid transplants by getting on top of it
Yeah.
quickly and early and get these medical therapies underway.
Absolutely. And with that, I will make sure that I put in all of your contact information, your website. Your website has an amazing spectrum of information, from products to your blog to your YouTube channel. So lots of information there, ladies, that I will direct you to. Any final words on hair loss for women in midlife?
Well, I would just say, don't give up on your hair. And I always say, if you think you're seeing the signs of hair loss, then please seek out the information, guidance, and information from a full-time board certified hair restoration physician. There are a number of us out there. As you mentioned, the website, baumanmedical.com, has thousands of pages that I've personally written, hundreds of hours of educational videos. And of course, you can just want to ask me a question about hair loss. Well, you could send it to Jill and we can do another podcast on it.
Right.
Or you could go to baumanmedical.com/ask and just type in your email and your question. And I promise I will get back to you with an answer.
You also do telehealth consultations.
Yes. So 40%, nearly almost 50% of our patients connect with the practice first through a virtual
Yeah.
consultation. That's a telehealth consultation. You have to fill out some information
Mhm.
because it's not just a simple consult. It is truly an evaluation of your situation. You have to
Right.
send us some photos. So it is quite detailed. There is a cost involved with that. And so you can select that option also at the website, or come in physically to the mothership, if you will, our
Right.
nearly 13,000 square foot facility right here in beautiful South Florida, Boca Raton beachside, not too far from the mall and from the Boca Raton Resort.
And lots of people fly in to see you. I mean, people fly all over the country to see specialists in all different areas of health and wellness. So if you're out there thinking, oh, wow, I never even thought that I could go see someone across the country, you absolutely can and should, if this is something you've been working on for a long time and you're not seeing the results. So Dr. Bauman, thank you again for joining us here on the Health Trip podcast and sharing all your expertise and wisdom on hair loss for women. It's an issue and we need to talk about it more and be more proactive. So thank you.
Absolutely. Absolutely, Jill. Thank you so much for having me. And your hair is looking great, by the
Isn't
way. So
it?
your
Yeah,
regimen
I'm
is
feeling good.
working nicely good.
Thank
And
you.
it's always great to be with you. And hopefully we can connect either another conference or another podcast.
Yes, thank you so much. And thanks for listening, everyone. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.